So let's start with the warm up first, and then afterwards we're going to have the 5 minutes of speaking. Okay? So let's begin. So good afternoon. My name is Hannah Torres. I will be your interlocutor for today. For verification purposes, may I have your name, please?
Hi, good afternoon, Miss Hannah. My name is Arlene Samidan.
How do you want me to call you?
You can just call me Arlene.
Okay, Arlene. So may I know why are you taking the OET examination?
I'm taking the OET examination because it is one of the requirements to apply for UK. So I'm trying my best to take this exam.
Okay. So have you also considered going to other countries aside from the United Kingdom?
To tell you to be honest, I don't have any plan for going anywhere. Only UK.
Only UK. Okay. So may I know if for example you are already in the United Kingdom, what would be the first area that you would like to visit?
Yeah. The area I think that I need to visit is the place of my aunt.
Ah, okay.
And
So
yeah,
does she live there as well?
she's living there for a long time, so I will tell her uh to give me a tour.
Ah, okay. So how about for example in terms of work, would you like to be in the hospital ward or in the community?
See, because I'm working for a long time for OPD department, and this time I want to be in the hospital also because I want to exercise my being a nurse.
Mm-hmm. So
So I
that's
want
why a hospital experience. Okay, so that would be it for your warm up. So are you already warmed up for our 5 minutes of speaking, or do you have questions for the with regards to the script?
so far I don't have any questions.
Okay, now for our script, the setting would be in a hospital casualty ward. I will act as your patient and you will act as my nurse. Ready for 5 minutes?
Okay, I'm ready.
Okay, so for 5 minutes, let's begin.
Hi, good afternoon. My name is Arlene Samidan, and I'm one of the nurses here in Hospital Casualty Ward. So, can you please tell me your name for the verification purposes?
Oh, hi Arlene. My name is Hannah Torres.
How do you want me to call you?
You can call me by my first name.
Hi, Miss Hannah. So, how are you today?
Well, I'm still feeling a bit woozy because of the accident, but so far I think I'm okay.
To hear that one. Basing from your chart, I can say that everything is stable. But there is one problem that we need to check on it, and we need to do some treatment with this one. That is what we call you are losing blood. So, you have any question about that one?
You were saying there would be a new management for me, so what would that management be?
Yeah, I'm sorry to tell you this one, but don't worry about it. It's a blood transfusion. So, did you hear about the blood transfusion?
You mean you're going to give me blood because
Yeah,
I
you're
lost
right.
some?
You're
Okay,
right.
but how are you going to give it to me? Is it via the IV line that I have here?
Yes, Miss Hannah, we will put as an IV line. We will put the blood through your veins. So don't worry about everything. Everything is under control. We will do it a septic technique, sterile technique. Okay. So there will be no infection because we will be doing it and we will screen the blood that we are giving to you. Is that
Oh,
clear?
okay, but you've mentioned aseptic technique. I'm actually not familiar with that term. What does that mean?
Yeah, it's a sterile technique. So it means that there is no bacteria, and we will be using like gloves, clean gloves. Okay.
Okay. Now I know I already have an IV line on my hand. So do you need to make another one or prick me with another one, or just you're going to use the one that I have already?
we will be checking your IV line if it's good for blood transfusion, and then we will use that same IV line. But if there's any problem, then we can pick the other one. Sorry to tell you this one, but we need to tell you that we
Okay.
need some IV lines if it's needed. Okay.
Okay, because the IV line a while ago when they tried to insert a needle on my hand, it's already painful. So for this one, will it also be painful as well?
Don't worry, Miss Hannah. It will not be painful. It's just the same that there will be just a discomfort. But if there's like itchiness, you can just inform us, then we can stop the drip. Okay? Don't
Okay.
don't worry.
Okay, so that would be very reassuring. Now, I mean, I know I'm not really familiar that much with regards to blood transfusion, and you said there wouldn't be any bacteria, but I learned before that, I mean, like HIV or AIDS and some other diseases in the blood can also be brought about by blood transfusion, isn't it?
I understand your concern, Miss Hannah, but the blood we are giving you is screened. So
Mm-hmm.
there will be no HIV, and there will be no other diseases that's in the blood. We already screened it. Okay.
Okay, okay.
And during the blood transfusion, don't worry because we are here. If there's any like reaction, we will be monitoring you closely. Okay, Miss Hannah?
Mm-hmm. Okay. But for how long will I have to be injected with blood? Will it be a long time or should I be sedated for it?
No, Miss Hannah, it will be around 15 to 20 minutes. So
Okay.
after that one, then we can give you again the same saline that we're giving you, the same drip that we are giving you, and then we will closely monitor you like your vital signs, your blood pressure, your temperature. If for example there is a high temperature, then we will stop the blood transfusion right away, and we will call your doctor. So if you have any more concerns,
Okay, that's it for the 5 minutes of speaking. How was it for you, Miss Arlene?
I think it was better than yesterday.
Yes. As compared to yesterday, no more pauses. Okay, and then I was able to hear more confidence in terms of your voice. The only concern that I have was the usage of ya because you've used ya 3 times. So instead of ya, I want you to correct it with yes. Okay, but other than that, this one is good. If you've noticed, I've asked question with regards to aseptic technique and sterile technique. Try your best. I know it is commonly used in the medical field, those terms, but try your best to make your wording as layman as possible. If, for example, you have mentioned the term aseptic, I know it is quite difficult to find like a synonym for that, then make sure to automatically explain what it means so that there won't be any confusion on the patient side. Okay? But don't worry for this one, I can still give you a B. Okay? How was it? Pwede na?
Needs more practice.
Needs more practice, but it's okay.